comments here. 4:35. It's after work hours for admin workers. So thank you for taking time to join, and for our members throughout, both on and off, our citizens. We are in month, I think it's 21. I lost track of months of addressing COVID-19, and it's been a tough go. This fourth wave has been our toughest of all of them in regards to the worst case scenario impacts, to cases transferring now amongst many young people. So what we wanted today is bring in Dr. Khan. Dr. Khan is a lead representative who directly with First Nation communities within this province. Dr. Khan, myself, and others like Kelly, our Director of Health, have been working with Dr. Khan, leading Dr. Khan for guidance. And we just wanted to offer this next hour to a discussion of what questions we may have, to what do we see the foreseeable future, misconceptions of maybe the vaccine or things like that. So we look forward to the discussion. Zoom, it is definitely, we treat each other with the utmost respect that Cowessess value. When there's questions that need to be, unmute yourself, and if not, nobody's speaking, then speak up. If you want to put it in the chat, please put it in the chat. We want to address as much as possible with the time we have. I'm just going to ask Kelly really quickly, what are our numbers at right now, just so we understand what we're sitting at in the community. And then I just have one more comment, and then I'll hand it over to Dr. Khan.
Thank you, Chief. So our numbers right now are, we have 9 active cases, but Heidi is still testing, and so that could change. And but it is starting to settle down a little bit now.
Yeah, so thank you. So it all started, our numbers went from 0 and up after Thanksgiving. We kind of sensed Thanksgiving was going to be a lot of socializing, and ultimately from Thanksgiving, numbers did start to go up. We increased very high to 16. Dr. Khan sent a letter calling the Cowessess Communication Center a pandemic at the moment. A little too much numbers. We have pretty much under control by teaching from home right now. Daycare closed. We are to reopen the school and daycare after Remembrance Day weekend. So we are to reopen it all pending on active cases. The COVID task team continues of council, executive, and directors on making sure that we are all working on this together. We put our workers back at the store, the post office, and we have doc at the band office, and ultimately to make sure people are wearing their masks, sanitize in areas like that. We're getting quite aggressive with our verification vaccine, and it's a I ain't gonna lie, it's tough, because much as it's a human right, it's a safety that we're trying to assure to our anybody in our business. And so anyways, without further ado, you could hear from me anytime. I'm going to hand it over to Dr. Khan. Dr. Khan, I definitely know you're a lot of information to talk about. Do have some questions already that we to ask. I want some opening comments for you right now, but spend the majority of our time answering questions, and if after that, if we have no more questions, then you could give us other updates as well. So Doctor, thanks for taking time to talk to this First Nation.
Thank you so much, Chief. Good afternoon. Hope you can hear me. Okay, good. Thank you, Chief. I really appreciate this opportunity and want to commend you and your team, Kelly, and everybody that is attending this call, and also the people behind your team have done an amazing job throughout this pandemic in different waves. So really want to commend and acknowledge that. I do want to say that I'm joining this call from Treaty 4 and recognizing that this history is very important to our future and our efforts in closing the gaps in health outcomes between Indigenous and non-Indigenous people. And I pay my respect to the traditional caretaker of this land. So before we start, absolutely, I will follow your lead, but I have a couple of key facts, key scientific facts, some information that I want to share with the group. Then I do want to touch on some of the 5 to 11-year-old vaccine, and then Kelly send me a couple of questions. I can address that too as you wish. But I have lined up some of the key question asked from me in other town hall as well, which are very, very interesting questions, and I want to share that with you as well. So as you wish, Chief, I'll just wait for your lead.
Well, thank you, Dr. Khan. Kelly, did we want to start asking some questions? I mean Kelly. Hi, Kelly Fremont. I see your picture there. I meant Kelly, our director of health. We had some questions that we already had some feedback on, and then we'll address some other questions for that.
Yes, so maybe we can start with the questions that I sent you, Dr. Khan, if that's okay?
Yeah, yeah.
Okay.
Yeah.
So,
Do you want me to go question by question? I can do that.
yes, if that's okay, sorry.
Absolutely, yes. There were very good questions, and I'm very happy that I'm joined with Laura and Genevieve and maybe some other people. I can't see everybody, but certainly we will do our best to respond to those questions. And I can certainly share with you what is happening and what do we expect in the coming 3 to 6 months. And we can certainly respond to questions. So question number 1 you sent was that how has the transmission, by the way, I have your, you asked for your community level breakdown for age groups and then the vaccination for first dose. I have that lined up as well, so we can share that as well if you want. But just going back to your first question, how has transmission varied in First Nations community with varying vaccination rates? So the response is that we have high activity in communities with some communities have low coverage, some communities have high coverage. We have seen mostly that the activity, the COVID transmission, the COVID dynamics, the COVID transmission is very high in communities where the vaccine coverage or uptake is low, particularly the second dose. So that is one big overarching sort of observation we are seeing. Provincially, we have seen correlation between low coverage rates and higher case rates in hospitalization, including pediatric hospitalization recently. We have seen quite a surge in that. Then we improve coverage, the better it will be for everyone. So wherever you see that momentum, the less we see activity, but also I don't want to forget or avoid the community level intervention. It also depends on that, how mostly of our communities are extremely vigilant, and they were perhaps the first one in terms of response to the situation by putting security measures, checking everybody in and out when somebody's leaving the community, offering testing for the travelers coming in and going out. So those intervention, and also communities have done an amazing job in terms of endorsing, enforcing the COVID precaution, the non-pharmaceutical intervention, for example, masking, distancing, making events like, if it's a funeral or a gathering or a ceremony, they did everything their best way to have the COVID precaution in place. That helps a lot in terms of how the COVID moves in and out of the community. So that was the response to that question. And certainly every community situation is very different. So the communities that I have a bunch of communities that are 100% for second dose, but I have communities like quite a good chunk that have achieved 85% for second dose. But I have like maybe 24 4 to 30 communities that are still struggling between the ranges of 40 to 50. And that is like the biggest sort of risk areas. And communities have explored all options, like, having incentives and highlighting it on their Facebook and their community websites and door-to-door campaigns and pop-up clinics and awareness campaign and lots of town halls, the way you're doing. That has helped a lot in terms of reaching out to some of the people. Chiefs are still very concerned about, I just got a call from a chief just before this call. He flagged a couple of individuals that are not compliant. And so those sort of measures help a lot that, how is the local sort of vigilance and strict sort of monitoring on the situation. So that helps a lot. The second question was the comment on the safety of pediatric vaccination. So as you have seen, the COVID vaccine has been rolled out globally, like millions and millions of people have received the COVID vaccine, from the clinical trial data to the population level data. All data is there is somebody not on mute. So all that data, from whether it came from the clinical trial or came from population level data, very strong evidence that the vaccine is working and very safe in terms of reducing, in terms of its impact on pandemic, which we all want to end very quickly, but also particularly reducing the number of hospitalization and severe outcome. So that is an overarching theme that has been seen from China to Europe to South America to here. We have also seen that the hospitalization rate, particularly the severe outcomes, ICU admissions, and unfortunately, the rate of hospitalization, the rates of complications, ICU admission, and death is very high for our indigenous people. But so far, the vaccine has shown its very, very good, significant impact on that particular severe outcomes. We are embarking on a new milestone, which is the age of 5 to 11-year-old. You guys have seen American kids are going ahead. They have 23, 24 million kids to vaccinate. So they're going ahead with that. We are waiting here for Health Canada. So based on the CDC data, the vaccine for children is extremely safe. Just wanted to say one thing, that a lot of people have a lot of following a lot of fake information and misinformation, which actually shape opinions. So one of the biggest fake news and misinformation that is circulating about the news is that in the news about the vaccine is that side effects and short-term side effects and long-term side effects. So basically, we need to follow the right information from World Health Organization to CDC. And here in Saskatchewan, we're following Health Canada and Saskatchewan Health Authority, Ministry of Health, really credible scientific information. So the side effects of the vaccines are extremely mild. And no vaccine is perfect, no medication is perfect, but particularly this vaccine, if you compare it with other vaccine, like the vaccine that we have for measles and mumps and rubella and chickenpox and flu vaccine, this vaccine is such a potent, such a significantly higher efficacy in terms of providing that protection and protecting you from hospitalization and ICU and these severe outcomes. A lot of people are asking questions about the mRNA. What is mRNA? It's actually RNA. mRNA is called messenger ribonucleic acid, and it's part of the RNA virus. What the vaccine does, what the vaccine has, is that it has this particular protein that triggers the immune system to generate more sort of response towards the invading virus that comes to the body through the respiratory tract. The vaccine in itself does not stay in the body more than a week. So as soon as you get the vaccine, it started showing its effect by triggering the immune system. Within a week, the vaccine components or the vaccine itself is being cleared by the body. So nothing is left in the body that would trigger either short-term side effect or long-term side effect. Basically, the short-term side effects appear in the first 24 hours, maybe to a couple of days. And basically, when my kids got the vaccine and when I got the vaccine, it was just mild sore sort of arm, maybe mild fever, a little bit sore arm, a little bit tiredness. But even that was felt by very few people. So other than that, there is no reason for people to believe that the vaccine stays in the body for months and it counteract with your DNA. That's all fake news. The vaccine components doesn't stay in the body. It's cleared by the body very quickly. But what we care about the most is that trigger that it provides to the immune system to make those antibodies against the virus, so that can give you that protection. So basically, vaccine so far, based on all the evidence, has no long-term effect, long-term side effects or short-term side effects, other than like the mild sore sort of arm, fever, and tiredness. Other than that, we have not seen anything of that nature. The other big misinformation outside is that the vaccine may give me the virus. That's absolutely not correct. Vaccine does not give you the virus. There is no actually virus in it. There is no live or part of the virus in it. So that's also can be easily rejected, that sort of information. So far, American kids are getting it. They're going ahead with more than 23 million kids. Argentina, Cuba, and China, by the way, is starting with age 2-year-old. The rest of there are many countries that are starting with even younger age groups and giving it ASAP. We're just waiting for the Health Canada approval. And hopefully that is expected to happen in the next week. And then behind the scene, Laura is on the call and she can certainly brief you a little bit about what sort of planning is taking place, how this vaccine will be rolled out to the children, what the nurses are doing, what the dosage is going to be, how the interval is going to be. So all those sort of information are being sorted out, but we're just waiting for Health Canada approval. And more details will come with the product monograph. Everything will be online. Any parents, any caregiver, any grandparents can read that. And by the way, this is a sign of a good parent. It's a sign of a responsible grandparent, and it's a sign of a conscious, well-educated grandparents, caregivers, parents, community member, that they ask question. Asking question make you look smart, that you care about the science and that you want to express your concerns and questions, and that's our job, to find you the answer. If we don't have the answer, we'll find you the answer. So I think asking question is the best, and I think everybody care about kids. Everybody care about kids. The whole society is revolving around the kids, and we heard again and again from parents that I'm not going for the vaccine until my kids get it. So I think the time has come. We are very lucky that we will be able to close this loop in the pandemic sort of response, that we will be able to immunize our little kids. So in terms of safety, I hope that is enough, Kelly. Do you want me to speak?
Yeah, there's a question in the chat that's asking for some tips for responding to someone who is an anti-vaxxer.
So the anti-vaxxers, there is so much evidence of the death, the mortality and the morbidity and the hospitalization that this virus has caused. Many anti-vaxxers that were against the virus and against the vaccine has actually accepted the vaccine recently. And you would have seen that story in the news that the Métis, it was I think a leader of the Métis Nation who actually who was very much against the anti-vaccine, or did not express publicly. And it was in the news, by the way, that after his experience being hospitalized and having the severe outcomes, he decided to come out publicly. And many people, many anti-vax and anti-COVID people have accepted the fact. And if you would look at the data, in the month of October, we have seen 6% increase in the number of first doses, and second doses is even higher. So I think that speaks to people are changing their mind. They're coming back. The ICU, one patient said that he spent 70 days in the ICU. Who would like to live like that? In ICU, bedridden, and all these pipes going through your nose and mouth, and you're away from your family. You can't touch, you can't hug, you can't kiss. And then you have these severe outcomes. So I think these are the evidence to tell anybody that, look at this, this is not a fake news, this is not a joke. And the road for the anti-vaccine and anti-COVID people is going to be short, very narrow, and it's coming to an end very quickly, because how can they move into society if you're refusing vaccine? Well, you can go to a concert, you can go, you can fly. So, and if you're working, your employer may ask you. So I think all these interventions are bringing people back to rethink that, okay, the whole society from, the global world, like, from China to here, this is a global phenomena, and there is so much science involved, there is so much evidence there, the number of deaths, the number of hospitalization, I think it speaks for itself.
Definitely. There's another question here that says, when responding to someone that claims that the COVID vaccine is nothing more than an experiment on us or altering our DNA, how can we respond in a way that will inform rather than being drawn into the conversation?
There is so much evidence about these and so much good scientific evidence that it does not alter your DNA. It does not even touch, it does not even go there. The body eliminates the vaccine components within a couple of days. Nothing stays in the body. So these sort of things are very, very fake and misinformed. There is no scientific ground. I also heard on one town hall that it accumulates in ovary. It impacts on your menstrual cycle, and it causes infertility. These are all fake news. So reject that right away. And if you need scientific evidence, there is a lot of scientific evidence for that. So, and also another big fake news is that, oh, by eating garlic or by eating extra pepper or some remedies that people can find at home would cure you from COVID. These are all fake news, and it has nothing to do with the cure or treatment. Yeah, I think these are all fake news, and we should really not pay attention, and also not spread it, not share it with their family members.
Absolutely, thank you.
Do you want me to go to the next question?
Yes, please. And Genevieve just put some tips in the chat for answering questions with anti-vaxxers.
Yeah, and another big news that, these magnetic chips are, is circulating around in the past couple of months, people showing a bulb. If you put a bulb on your arm site where you got the injection, it will flash up. Or Bill Gates is watching us because we have the vaccine now. All these are very fake news, has no scientific base, and it's just to scare people and to push them actually into a very, very dangerous sort of lifestyle and risks.
For sure.
Okay, so your next question was that, are schools open in other communities and with low vaccination rates? So first of all, our job is to give communities the facts and the current stats. So we've been sharing with the communities their COVID numbers, like the total COVID number, active cases, deaths, hospitalization. Apart from that, Cindy and the team also send very regularly the vaccine community immunity tracker. So you guys know the best and have the best accurate information, but whatever we have, we share that back. But communities make decisions differently. Most of the time, I'm involved, our team is involved. We give our guidance on whether the school should remain closed or open. But most of the time, the chief and the chief and council make a decision and they close the school. And I understand that there's a lot of fear and scare in the community, and parents want to protect their children, and the fact that under 12 were not vaccinated. So you can understand all that. But basically, the decision to either to close the school or open the school is all in the hand of the health directors, the chief and councils, and the education directors. And basically, they have all the evidence, they take those decisions. We don't find that closures are based on coverage rates, but rather based on COVID-19 exposures within the schools. We currently have 14 schools at level 4. Fully virtual learning or via home packages. Approximately 1/3 of cases reported in First Nations communities are among school age kids in the 4th wave. Some First Nations have implemented vaccine policies for their school staff to keep kids safe. And we do expect rates among school age children will decrease with the pediatric vaccination as it's coming in the coming week. So that's all what I can say about that. Do you want me to move to the next question?
Actually, I have a few questions that are showing up in the chat if I can do that.
Okay.
So I have a question. Are fully vaccinated individuals contagious? And if so, do you recommend that fully vaccinated teachers and daycare workers rapid test daily if they are working with children who are not eligible to be vaccinated?
So depending upon the local risk, so here I would really bring to your attention that look at your risk. If your community is a high burden communities, poor vaccination rates, under 40, do everything you can to detect the case, to isolate the case, and to implement stricter and rigorous sort of policies and interventions. So if you are 80 and 90 and 100, about achieving 100%, so we can relax a little bit, but I would still urge everyone that you keep the COVID, all the COVID intervention like the plexiglasses, distancings, masking, hand hygienes, and still striving and aiming for higher immunization rate, and particularly for children. The same for staff. Till you achieve that over 95%, that will give you a peace of mind and safeguard that you are protected, and perhaps that will be you will see lowest and lowest circulation of COVID in that situation. But till then, I mean November, December, January, February, March even, we're going to watch how this fourth wave is going to evolve into a fifth wave. So the prediction is that we still have, Dr. Shahab said that yesterday, that we have still approximately 300,000 people are unvaccinated or partially vaccinated. And we have 11,000 children in indigenous communities on reserve currently unvaccinated because the vaccine they're not eligible. So till we cover that, and as I mentioned, a majority of the community are still under 40. Till we achieve that, I would say confidently and safely keep all the COVID precautions in your schools, in your band office, in all settings. And depending upon your local risk, if it's high, then more frequent testing. If it's low, then maybe once a week for those that utterly needs to be tested. So I would give you, that would be my advice on that one.
So our rate right now, just so that everybody knows, the last update I got from Cindy, I believe was 56%.
Yeah, so I was really hoping that it was better, but when the team give me the stats, so for your 12 plus, for first dose, you are currently 62%.
Okay.
And for your dose 2, 12 plus, you are 55%. So I have the age breakdown for 12 to 17. For dose 1, you are 76. For dose 2, you are 68. For age 18 to 49, for dose 1, you are 50. For dose 2, you are 29. And that's your workers, that's your labor, that's your task force. For 50 to 69-year-old, your dose 1 is 72% and dose 2 is 72%. So that's good, but still we need to aim above 90 above. And 70 plus for dose 1 is 59% and dose 2 is 59%. So, we're somewhere in the middle. We're not out of the woods at all. And we really need to convince everybody, particularly the grandparents, parents, caregivers, everybody. First of all, they bring their children, 5 to 11-year-old to clinics and immunize them. And then also people who have, I think it will depend on many things. First of all, I don't know how many people were eligible for booster doses in your community. And if they received their booster doses 3 months ago, I think, the recommendation is that, at least 60 days and stuff, you have to, people who have received the second dose and were eligible for the booster doses, they would have a waning immunity. So we need to really keep an eye on that people who has more than 6 months for the second dose, they must get their of course, they would be in those eligible groups. They need to get their booster dose. So we're going to watch that people who have received the booster doses 6 months after their second dose, we would have to watch their waning immunity, and we perhaps there may be new recommendation end of this year that what we're going to do with them, and also for the general population, what we're going to do with them. Would they need a booster as well or not? Many countries have gone ahead and given a booster dose to everybody above 12, but that is not the practice here in US and in Canada. So certainly, I would urge Kelly that you work closely with the nursing team and make sure that anyone who has more than 6 months after their second dose and were part of those eligible groups, that they have received their booster dose. And if not, we should give it to them immediately so that you can protect them for Christmas and New Year, because no matter, like everybody's immunity would wane with time, even if you are an immunocompetent person, but the immunity goes down very quickly among people who are immunocompromised. For example, people on dialysis, chronic kidney conditions, HIV, hepatitis C, elderly people, they're very vulnerable. So I think we should never assume that I'm protected, I got my second doses and I'm protected and I should just go free. No, you should still wear a mask, be very careful where you go, make sure that wherever you go, you know who are you joining in a party or in a gathering or in a club, that you know who are you joining. Is that business or that workplace have a policy on, 2-dose vaccine. So just make sure that you go to a safe environment. And, Christmas concert, New Year concerts, a lot of gatherings will be happening. So we need to be careful that even with 2 doses, wear a mask, keep a distance, and be careful if you have symptoms or somebody has symptoms, ask them to leave, get tested, and those sort of things.
Thank you, Dr. Khan. The next question in the chat that I have says, what happened to those individuals that passed on and were fully vaccinated? Were there other underlying issues with the patients?
Yeah, so that's a very good question. And there's a very good breakdown of that information provincially and in our communities too, that majority of the hospitalization, Kelly, and ICU and deaths have happened among people who were either elderly and they had a waning immunity, or had a chronic conditions and multiple chronic conditions. So that's where we have seen most of the hospitalization and deaths. And particularly, we have seen deaths in almost all age groups, but more above 50 and 60 and above, particularly those people who had multiple chronic conditions. And actually, they die in the hospital from maybe heart attack or stroke or any other illness, but COVID-19 is a contributing factor. Like it was diagnosed either in the hospital or they were admitted with it or left the hospital with it. So these deaths may not be 100% due to COVID, but there are other chronic multiple conditions as well.
Great, thank you. That's all the questions we have in here in the chat. So maybe if you can go on with the ones that I sent you.
Okay, so the next question is, is there a correlation between community vaccination rate and closures? So we do tend to see these temporary closures in school where community transmission is high. A reminder that many of our school age kids are not yet vaccinated with some of the lowest vaccination rate in this age group. Many those under 11 of age are currently ineligible. So certainly that plays a big sort of factor. But vaccination is a very big protective factor, and it does help a lot if you're all age group. And now we are lucky that we are also getting the 5 to 11-year-olds. Certainly, there's a better hope that we will have that this particular age group would also close the loop of further circulation and the evolution of this virus. So certainly that would be a very important thing to watch. How does the vaccine help against the variant? So far, based on all the data, whether it's the clinical trial data or population-based data, there is a quite good evidence, and the most infectious or the most highly transmissible variant among all COVID was the Delta one, which is currently still circulating and is still very dominant, and it's actually kicked out all other variants. Even against that variant, the vaccine, particularly the mRNA vaccines, are very effective. So that is a very good evidence and a sign of relief for a lot of people. We do see, as I mentioned, that no matter if it's a mRNA vaccine or other vaccine, the immunity goes down as you age and as the time passes after your second dose. So certainly, even with the best vaccine in the world, which is the mRNA vaccines, that's the reason people are getting the booster doses, because the immunity wanes, and as the immunity goes down, you're susceptible again to either Delta or any other variant that is circulating. But so far, Delta is the most dominating strain, and to that, the vaccine is still very effective. So I think we should go for it. And till we see in January, maybe we'll see how these variation evolve. We have seen always an evolution of these variants. One comes and kicks the other one. One come and make the vaccine a little bit less effective than the others. But so far, the mRNA vaccine has been very, very successful, effective in terms of the symptomatic, in terms of the ICU, and in terms of deaths. So I think it is working, and I think the whole world is moving towards that, to keep giving the vaccine. The problem is that we are very lucky and fortunate that in a country like Canada, US, and many European countries have access to the vaccine. I think I heard that 80% of the global vaccine goes to only 20 to 30% of the world population. So again, there's a big chunk of the world population unimmunized and has no access to vaccine. And that is the fear that it may bring back the virus back with even more sort of virulent strains. That's why Canada and US and many European countries are generously giving whatever vaccine they can give to other countries, because imagine just Vancouver Airport. I heard in this pandemic that 3,000 to 10,000 people actually fly from China to Vancouver, just Vancouver, and just add other airports. So that's how connected we are. So if you like, everybody's very connected these days. People fly a lot from Africa to South America to Asia to North America. And if there are countries that have perhaps a new virulent strain circulating and they are here by tomorrow morning, then all of us are susceptible. So that's why there is a global equity question on how the vaccine should be shared with others. And here we have plenty and plenty of vaccine. The fridges are full and the nurses are ready. And still we have a good chunk of population unvaccinated. So it's very unfortunate, but I think that is the reality. Why are First Nations people more vulnerable to COVID-19? The reasons are very obvious. It's not just COVID. Many other diseases, for example, tuberculosis, respiratory infections, people who breathe in the same airspace. And if you are 10 people in one room or 2-bedroom house, you cannot escape the virus or the bacteria. So overcrowding, close proximity, large families, more travel, more transiency, these are the factors make us more vulnerable. On the top of that, chronic conditions. Every Indigenous person, every second Indigenous person that I know has multiple chronic conditions. And that actually adds to the fuel of the risks. So certainly that is an extra vulnerability for tuberculosis, for HIV, for soft tissue infections. We had the highest rates of MRSA, which is a skin soft tissue infection. In our Indigenous communities in Canada, you would not see that anywhere in the world. Is because lack of access to water, clean water, lack of hygienes, lack of access to proper hygienes, overcrowding. and then exposure. So for example, if one person has TB or MRSA, well, there is so much hugging, and the whole culture is of, living together, looking after each other, caring for each other, expressing love and affection. That's what our culture promotes and does. And in those situations, if there is any infection, I think it's spread from one person to another very quickly. So I think these are our risk factors that we see in almost all communicable diseases. Why is it that Indigenous people are not wanting the vaccine? What is the norm and pattern in other First Nations communities? So there is one overarching theme. We participate on a national calls with all Indigenous doctors and nurses. So we have a group at the national level that all Indigenous doctors and nurses that serve First Nations in this country come together with Dr. Tom Wong. So we have that table. Then we have provincial table. We come together with our SHA medical officer, doctors and nurses and hospitals. So one overarching theme that I see across Canada is that, of course, lack of trust on the government. So that is number one factor in every sort of matter, whether it's the healthcare service, whether it's the information, whether it's the overall relationship. So trust plays a big role in that success. So if there's a trust, people listen to you, you work together, and we interact, and you are trusted, and then your information are taken seriously, and your advice is taken seriously, and the people act on it. So trust is the biggest factor. Certainly, and a lot of things erode trust, whether it's the racism, discrimination, inequities, disparities, injustices. These leads to more mistrust. And then no matter if you're working in a pandemic or working on tuberculosis or HIV or any other health issues, you cannot effectively or successfully respond to that situation if there is no trust between you and the community. So trust is very important. And usually government officials are not trusted. Bureaucrats are not trusted. That's the fact. So that is one thing. Second, I think there is a lot of misinformation. If you were to compare 50, 60 years ago, I don't know who is 50-year-old or 60-year-old in this group, but if you were living, if you remember 60 years ago or 50 years ago, life was very different. You had one television, or maybe even television was not available to everybody. You had very specific ways of getting information. So maybe a newspaper would be the only source you would get information. Now, the difference between now and then is that every kid, every individual has either one or some has two devices. So digital access is so easy, and anybody can access anything. And that's why, whether it's the fashion, show business, marketing, medications, anything, people have so much access to people. And it doesn't take much. It doesn't take much time for somebody to be famous like Lady Gaga. I mean, just one song take you where, and you are on the top. You're on the top chart. That happens in medicine. That happens in everything, fashion and marketing, communication. So the digital access has ruined the entire medical community, and that's where the anti-vax and the anti-COVID people are having the best influence. And their reach out is even more robust than us in public health. They have more access to people than us. So I think misinformation, digital access, global digital transformation has actually very misleading. And it just promotes fake news. And within seconds, you can reach out to thousands and thousands of people, and you can shape their opinion by the good way or a positive or negative way. So I think that is our dilemma living in this century, that through very hard work and repeated information, and you have to really prove yourself, you're credible, you're scientific, and you're accurate to make people trust you and to make people hear you. So I think with that digital storm, the infodemic, and all these things play a big role in shaping people's opinion. And that's what we are seeing everywhere, but mostly in our First Nations, because Not everybody has a computer, not everybody can read, or not everybody has access to a doctor. So I think if you have a doctor or a nurse or any healthcare provider, or just anybody who is health conscious, I mean, we should be asking those questions, we should be informing ourselves, and we should really spread accurate information. So that is our dilemma living in this sort of time and responding to the pandemic. So Kelly, these were the key questions, and I'm still available if there are more questions.
Sorry, I was on mute. Thank you, Dr. Khan. Is there anybody else? Can we just open up the floor for questions then now?
I saw a question about children wearing masks. So I think any children, any age group, I mean, certainly you wouldn't want to put a mask on somebody who has respiratory conditions, or a mask can compromise their breathing. So not little kids, but any other, like, above 3, 4, whoever is comfortable wearing a mask in any setting is a good habit. 3-layer mask, medical mask are better, but homemade masks are also good. So I think I see very little kids, even daycare kids sometime on the street when they are waiting for their bus or being picked up, wearing a mask. Good habits always help. Good habits have protected us in this pandemic before the vaccine was available. And that speaks to the 0 cases of flu. I mean, we have 0 cases of flu last year. So far, I think I heard only 16 cases in Canada of flu. How can that happen? I mean, this never happened before. And this is happening is because everybody's wearing masks, everybody's careful, cautious. People never listened to these things before the pandemic. So now they understood the benefit of wearing a mask. So I would suggest whoever who can tolerate wearing a mask, a good mask, please put the mask on them. And keep it till March at least when you go out. Outdoor is definitely safer, but more indoor, particularly in gathering or when you're meeting a large group of people.
Okay, thank you. Malcolm, did you have your hand up?
Yes, I did. Am I Trishka? Oh, okay. No, thank you for your time there, Doc. I think my question was kind of answered, but when it comes to booster shots, is this something you feel that's going to be called on every 6 to 8 months? Or like I told a nurse today, we got to quit meeting like this.
Yeah. So very good that you're asking about the booster doses. I think Laura and Genevieve can certainly put that criteria for batch 1, batch 2. I mean, there were two different categories of people eligible for the booster doses. And if you are one of them, please do get your booster doses as quickly as you can. If 6 months have passed, and in certain situation, they can give you even earlier, depending upon your condition and if you're immunocompromised. So booster doses are good. It does give you that extra protection. After 6 months from the second dose, the immunity goes down and it wanes. So I think, and it goes down in people who have chronic conditions faster. So I think if you're worried about the Christmas celebrations and getting together with your family, and the booster dose certainly would help if you would be eligible. So I'm glad you're talking to the nurse, and she certainly can give that to you or anyone in the community if you are among those list of people.
Yeah, I got the booster shot today, and my question was more or less am I going to have to be called in 6 or 8 months again to get another one?
Yeah, we don't know that part of the answer but what we are hearing is that again, you have seen every week, every month, we have a new science coming in supporting and backing us, our intervention. So far, the booster dose should protect you at least till mid next year. And by then, I'm sure even by Christmas, there will be new science and new recommendations for you and for general public as well. So we'll just go based on that. But for now, you are protected, you're good. But I will still suggest with that, with the booster doses, I would still suggest that you carefully wear a mask and, meet and greet with people with as distance as you can, and just protect yourself by adopting and following those good habits.
Hi. Thank you for your time.
You're welcome. And just one more thought for you before you go, that in case anytime in the coming weeks and months, if you get symptomatic, if you develop any symptoms, I know you got a booster dose, but if you get symptoms or any sort of respiratory or any other symptom, I would suggest that you still connect with a doctor quickly and sort it out that is not COVID or nothing else that that needs to be checked out quickly. So I would suggest that watch, and if you develop any symptoms, I mean, there are a lot of other viruses and bacteria circulating too. So just being more careful.
Dr. Khan, Kelly, this is Chief Delorme. Thank you, Dr. Khan, for spending some time with us. I have one question. Could you explain or share of how nations of patterns are going with unvaccinated people spreading COVID more than vaccinated people? We're trying to address the misconceptions and the trust issues of our fellow family members who are choosing not to be vaccinated. But is there patterns you can share about how COVID spreads? Because we know that if you're vaccinated, you still have a chance of getting it. It's just that your chances are low.
Yeah. So that's a very good question, Chief. And my advice is that people who are unvaccinated, they certainly are more prone to, and especially if you have underlying condition, more prone to severe illnesses or severe outcomes if you get COVID and you are unvaccinated. Also, they also get severe symptoms and hospitalization, and certainly the spread from those people depend on symptomology. So if you are sneezing and coughing in public places or touching, spreading your droplets, certainly based on the science currently, that if you have severe symptoms, that severity of symptoms, like, if you have a deep cough and a loud cough, then certainly you are exhaling or throwing out more droplets in the airspace or around you. So certainly that speaks to the infectivity from those people is higher for others. And people who are vaccinated, and if they get exposed to COVID, may still get mild symptoms. And based on the evidence that viral shedding from different secretions, it has been seen that the virus shedding from people who are vaccinated is very low. So that's a good sign compared to those people who are unvaccinated. The rate of complication is very high for people who are unvaccinated. For example, people are worried about the myocarditis and all these sort of things. The rate of myocarditis from getting COVID, from being infected from COVID, is way higher from the vaccine. So certainly progression to severe outcome is faster. And those people seems to shed the virus for a very long time. It means they will be infectious for a long time, and they may be infecting a wider circle of people. And again, symptomology is very, very critical. If symptoms are severe, pronounced, and loud, like, deep cough, loud cough, sneezing, those sort of things, certainly it just exhale or leave more virus particles in the airspace around them.
Well, thank you, Dr. Khan. Kelly, is there anything else that we wanted to cover in this meeting?
I think that's everything, unless there's any more questions. And I'm not sure, Dr. Khan, you had said you wanted to share some statistics, or were those already shared?
I'll just look at that, and just wanted to say that Oh, the mRNA vaccine, sort of, a lot of people ask that question that, where's this mRNA coming from? This technology, this approach has been in medicine for decades, and it has been used for Zika virus, as rabies vaccine, cancer research. So I think this is nothing new. The severe outcomes from coronavirus infection is way more than the vaccine. There is no impact on infertility. It doesn't accumulate in ovaries, doesn't interact with menstrual cycles among young girls and women. It's safe in pregnancy, in breastfeeding, as long as you follow those precautions. Other than that, there were a couple of things that I wrote it down. That very important point that people are still thinking that if you got COVID infection, you don't need the vaccine. That is a big misinformation. You still need vaccine, and perhaps the immunity from infection plus the vaccine is more robust. So all people who had COVID infection, we would urge them to get COVID vaccine ASAP. If you don't have symptoms, you can certainly go and talk to your nurse, and she will give the vaccine. The other big question comes in town hall is that the flu vaccine, does it protect you against COVID? No, it does not. So COVID virus is a very different virus. The COVID vaccine is a different vaccine, and it does not protect you from flu, or vice versa. So anyone who has received COVID vaccine, we are also urging them, encourage them to go get the flu vaccine as well for this flu season. The virus does not transmit through water and swimming pools. And I kind of touch on the Bill Gates theory as well, that he's not watching us anymore. Some people think that after 2 doses, Bill Gates started watching you, and your blood some sort of radiates, and these are all misinformation and fake news. And that vaccine does not have any virus in it, and it does not cause infection. That all people will be dead in 2 years after post-vaccine. That's also big misinformation, and a lot of people being really misguided by that. I would suggest that we should follow really information from credible scientific resources. And in this case, we've been sharing information with our communities very regularly, and the chiefs have all been very well briefed on weekly basis. We can have many more sort of sessions on targeted topics if you have questions or people have questions.
Well, thank you, Dr. Khan. I just wanted to verify to Malcolm that you could still have children. What Dr. Khan is saying, that it doesn't stop that. So I just wanted to start to close, and if there's no more comments or questions, that this pandemic is still here for the foreseeable future, and I'm tired of it. I know a lot of you are tired of it, but we're doing amazing. Dr. Khan, thank you. You help Cowessess in ways I don't think you realize, so thank you, and keep up the great work. We just wanted to have this, and Dr. Khan will probably call upon you again in the future to do this again. I just wanted to share with everybody that we just got our daily numbers. I'm about to post it. We're at 5 active right now, so that is great. Like, we're getting down to 0 again. Our 5 are safe at home. They're working with us. So we're getting there. And Dr. Khan, thank you very much as well. Thank you, Kelly, for organizing this. Kelly, if there's no more questions or comments in the chat, I guess we can call this this meeting to an end, and Dr. Khan will reach out if we require anything immediately.
Thank you so much, Chief. I love you guys. Thank you so much for all the good work. And I can come and I can talk anytime you want me to, but just please stay engaged and look after yourself, and have a wonderful Christmas and New Year.
Thank you, Dr. Khan. The same to you.
Take care. Bye-bye.
Chief Delorme, Cindy, maybe next time he can sing like Lady Gaga.
We'll start 5 minutes earlier next time, Dr. Khan, to hear a song.
Thank you.
Thanks, Cindy.
Take care.
Thanks, Dr.
Bye-bye.
Thank you.